Want to say thank you to the WCVIS for inviting me to speak on tips for undergraduates. My name is Jonas Kruse, and I will be doing kind of the first part of the presentation, then hand it off to Viraj Patel. I'm a fourth-year medical student at the Burnett School of Medicine at TCU. So, moving on. So just a brief overview for the undergraduates that maybe are here today that weren't here yesterday. Vascular and Interventional Radiology is the newest residency officially approved where you match straight out of medical school. I don't have time to go into everything that VIR does because if you ask 100 different people, it will do 100 different things. But vascular and interventional radiology is usually minimally invasive image-guided procedures from head to toe that is becoming more and more clinically focused by the day. It's becoming a clinical training pathway in a clinical field where they are managing their patients. And so they are truly comprehensive head to toe interventionalists. There's multiple training pathways. You can go through it through diagnostic radiology or match straight out of medical school, like I mentioned, but that's a little bit down the line. So I really want to focus today on tips for undergraduate students. So if you're an undergraduate student interested in VIR, evidenced by the fact that you're at this conference right now, I want to start with saying you are way ahead of the game. The majority of people that are currently within vascular and interventional radiology found it later in medical school, let alone before medical school. But kudos to you. It is the coolest field in the world. And every day that I step foot in the angio suite and spend time listening to the amazing mentors in the field, I'm more and more affirmed that this is absolutely the coolest thing in the world. So kudos to you. But with you being way ahead of the game, there's some specific points here. When it comes to undergraduates, I think the approach when you are accepted versus applying can be a little bit different. If you're already accepted into medical school or choosing between different medical schools, you want to set yourself up for success. And that also goes for when you're applying to medical school. What I mean by that is picking a strong medical school will always be helpful down the road, but setting yourself up for success also means giving yourself the opportunity to choose a medical school that is going to help you meet your goals as well as be supported along the way. So setting yourself up for success. If there's a school that maybe has a little bit more prestige, but you are in a place that you're not happy, or you are not surrounded by a support system of any kind, being with a support system allows you to thrive throughout that process. And so this is me speaking from a fourth-year medical student perspective, but it is a very long journey. And if you look at all the years together, it can be kind of daunting. But I want to let you know that there are ways to go about it to where you feel supported along the way and successful. My one soapbox, because I'm going to let Viraj Patel talk a little bit more about the specifics for the resources within VIR. My soapbox is MCAT studying. I used to teach an MCAT prep course, and I did it, and I taught it multiple times. I feel like mindset is everything when it comes to this. Because people are focusing on college and they're focusing on extracurricular activities, I find that undergraduate students often make it to their third year or fourth year of college, and they say, okay, this is the semester that I'm going to take the MCAT, and I need to fit it into my current schedule. And what that usually looks like is that they take maybe one less class, and then they still have their extracurriculars, whether that's, they're going to their AMSA meetings or they have their volunteering, and all those things are awesome opportunities. But realistically, if I said that your pre-health department is going to offer a test, and that test is going to be weighted like a final against all of your other grades, and whatever you scored on that was going to determine your entire GPA 50%, and you don't have to take it until you feel ready, I feel like you would approach that test differently than I feel like the majority of people approach the MCAT. So I think mindset is everything when it comes to this. Don't study for it after you come back from your AMSA meetings. After it is just as important as every other test, and it's one of the few objective metrics with how many undergraduate universities there are that you can use to your advantage. And it's a daunting test. It takes a lot of different resources, but don't reinvent the wheel. There's so many resources online for people who have done this and been successful at it. So if you haven't taken the MCAT, really consider your mindset when it comes to studying for it, because that is going to determine so much when it comes to how well you can apply for medical school. And then you're going to continue building on that same skill set. The skill set I used to study for the MCAT is similar to the skill set that I used to study for the board exams for medical school, which is going to impact how you move forward into applying for residency. And with that, I want to touch on study skills. The whole goal of your job, your position as an undergraduate student is not to say, okay, I am crushing 20 papers of vascular interventional radiology. Extracurriculars are fantastic, but it is a continuous process of building sustainable growth skills. So sustainable effort and growth. If you pull 4 all-nighters in a week and you're like, wow, I got a lot of studying done, but you are completely burnt out the week after that, then that wasn't a good week, regardless how many hours you actually put on paper. The entire, your goal is to take it from your freshman year to your sophomore year, junior and senior, and get better and better, more efficient at studying. And what I mean by that is that the way that I studied in medical school is different than the way I studied in college. And the way I studied my second year of medical school is different than the first year of medical school, and so forth. And you find a way to get more and more efficient and better at what you're doing so that you can accomplish your goals, but not feel burnt out at the end of it. If you burn out in college or burn out in medical school, it's so much harder to take that next step. And so I really enjoy this process, and I think you can thrive through it, but you have to find a team that helps, or a system that helps you be sustainable as you get better and better. And part of that comes from mentorship. Mentorship is kind of a buzzword that people like to throw around. You like to have, oh, this is my mentor. Mentorship can be so many different things. It can be a student maybe a little bit down the road. It can, or a little bit farther along the pathway from you. It can be a classmate. It can be a parent. It can be a professor. It can be a physician. But when it comes to mentorship, I think there's good mentorship, and then there's kind of buzz mentorship. And mentorship can take so many different forms, but find people who have walked the path before you and connect with them, because it's not all on you to reinvent the wheel. So specifically when it comes to mentorship, what makes a good mentor-mentee relationship? It's good to have like-minded goals. It's also important to have personality fit. Somebody may be somebody that you respect from a professional standpoint, and then you connect with them and realize this, for whatever reason, I feel like I'm really having to force this relationship. You want to find somebody that clicks with you and that has your interests in mind. And it's a two-way street when it comes to this, and you can have a ton of different mentors. So from the mentor's role, their job is to guide the mentee towards their goals, and find what works best for them. And if they feel like they know somebody else who is maybe a little bit more in line with what that mentee wants to do, they're shepherding them into what the mentee is looking to go into. They're also offering assistance and constructive feedback, which takes me to the mentee's role, which is being receptive of that constructive feedback, being an active listener, showing up on time, accepting feedback. These are all skills that, as you progress from level to level, become critical. If you show up on a rotation as a medical student and you're like, oh, I have really great board scores, but I'm showing up, 30 minutes late every day, you're shooting yourself in the foot. And so these are all progressive skills that you're going to build on. And as an undergraduate, it's important to focus on really building those core abilities that are going to help you be sustainably successful down the road. And then you're going to be a continuous learner. This comes back to that growth mindset. When it comes to resources, I'm going to just briefly kind of pass over this because this is where Viraj Patel really has a lot of opportunities, but there's the SIR website. It's a phenomenal resource when it comes specifically to vascular interventional radiology. Viraj is going to talk about the shadowing opportunities, but there's conferences where you can meet people, and then there's social media. And when it comes to social media, that's coming from somebody who is not really big on Twitter. But I had somebody kind of really pull me into it, and I'm so glad that I did, because it makes everything within the field so much more accessible. I feel like there are people that I walk up to at a conference and I get to shake their hand. They're like, oh yeah, we've interacted on Twitter a little bit, where 10 years ago that just wasn't at all a possibility. So I want to encourage you to create a professional social media account. And I had somebody recommend this to me 2-3 times before I eventually did it. But it's allowed to bridge so many gaps. It's allowed me to connect with people that have been instrumental in my career and really mentored me at each step of the way. So summary: if you're an undergraduate student in this conference, take a breath. You were way ahead of the game. It is awesome to see people so early involved. I found vascular interventional radiology so much later than anybody, anybody who's currently in those shoes. So kudos to you there. It's the coolest specialty in the world. Your job right now as an undergraduate student is to study hard and get good at studying hard. There's a difference between spending 14 hours to accomplish 4 hours worth of work. And if you can cut it down, you become more and more efficient. It really opens up the doors for you to be successful and sustainable and happy long-term. Because I want everybody in this room to be sustainable in their study mindset. There's that cliche statement, how do you eat an elephant one bite at a time? It's the same when it comes to becoming, an attending vascular interventional radiologist. You don't focus on how many years of training it's going to be. You focus on what do I need to accomplish today? What do I need to accomplish this morning? What do I need to accomplish this week? And the time will pass, and you will be able to focus on the things that you enjoy as you go through that process. Find your support system. That means classmates. You want to surround yourself with people that are of a similar mindset, effort, and that really build you up. That's been one of the most important things to me moving forward. So congratulations for being here. Thank you for giving me the opportunity to speak. I want to thank WCVIS for giving us this opportunity. I'm going to pass this off to Viraj. There's my email and my phone number. Feel free to reach out, especially when it comes to MCAT studying or applying to medical school. I'm happy to read through personal statements or pass off this to people who I really trust in that process. But it's a marathon, and there are so many people that are enthusiastic to help you get to your goals. So thank you for your time.
Cool. So hi, everyone. My name is Raj Patel. I'm a second-year medical student at Albany Medical College, and my presentation is instead a little bit more about being interested in vascular and interventional radiology as a pre-med. So not as much about how to get into med school. I'll appreciate Jonas's input on that, because to be completely transparent, I went through a BSMD program, so I don't necessarily have the traditional experience of applying to med school or anything along those lines, though I will offer some resources in that regard as part of my presentation. But so if you're interested in VIR as a pre-med, what's the first thing that you have to do? Well, you're here, and I completely get it if this is your first exposure into VIR, into this amazing specialty. And if everything seemed amazing to you today, you need to figure out if you really like it. I still remember going to my very first symposium. That was actually how I was first exposed to IR back when I was pre-med. And, it was honestly, to me, the coolest thing ever. But you can't really, I guess, put all your eggs in one basket based off of 1 or 2 day event. You really need to get to know it. So how do you do this? Well, you can shadow. Obviously, the best way to do this is to shadow in person. If you have a VIR department close to where you are, either at home or where you're doing your undergrad, definitely use that as an amazing resource. In general, people in the specialty are very, very open to having you around. They want to share the specialty with everyone. So don't be afraid to reach out. It is a very close-knit group, and everyone's very nice. No one's going to bite. But even if you don't have something along those lines, something that close to you, you can definitely shadow virtually. And that's actually something that we launched as part of essentially the group of this symposium, the virshadowing.com. I'll put the link in the chat after I get off, but we've essentially have virtual small group shadowing sessions with different attendings from all across the country, and actually internationally as well. We've had a couple international speakers. Some of them you actually might have heard from yesterday giving some of the talks. So a lot of these people are experts in the field, and have a lot of insight to share with you. To date, we've given around 20 or so shadowing sessions, and we're planning on having much more, as many if not more, this year. The other thing that Jonas talked about was mentorship. So I'm not going to talk as much about this, but I wanted to drive home a point. You should not only look at people at different stages in their career, in the path that you want to go down, but you should have people at different stages to talk to. That means having an attending mentor, resident mentor, and med student mentors. In fact, one of my mentors is a med student right now who's literally 1 year ahead of me, who's interested in VIR. And that's actually been honestly probably some of the most helpful advice that I've gotten for my day-to-day, just because he was in my shoes literally a year ago. He can tell me what he wish he did, what worked, what didn't, and that is actually very, very valuable. You can also read if you don't have access to anything immediately. JVIR, which is the Journal of Vascular and Interventional Radiology, it's the journal that publishes a lot of the IR studies that happen in this field. And then there's the IR Playbook. Now, this book is near and dear to my heart. One of my in my very first interactions with Dr. V, he actually recommended this book. And if you've noticed, when you go to these meetings, that a lot of the things sort of go over your head because you don't have like some of the basics or some of the anatomy or anything along those lines about like the procedures that they talk about. It's a great book that was written by people in the field that really explained it to a level that I was able to understand as an undergrad. And it really gives you like that solid baseline for understanding everything that you talk about. So maybe like probably start with the playbook, just get a little bit of a baseline knowledge about what actually goes on in the specialty before you move on to like something a little bit more advanced like JVIR. Now, if you really love VIR, what do you do? Well, the next thing is just to get involved with the community. Continue to attend meetings like this one. There are other much larger meetings as well, like SIR 2023 that's happening in Phoenix. So if you're close by, that's definitely something that you can like look at. But there are also like a bunch of symposia and other conferences that are happening all the time. This is where Twitter actually comes into play because I hear about a lot of them through Twitter. And so like that's like one of the great things. You can also get involved with SIR. The SIR has the Medical Student Council, and they put up projects all the time. And these projects, they actually sometimes can use like the pre-meds, like I guess input. You guys give like a very valuable perspective, and actually like use that. That is something that we are looking for, and it's like a value that you can provide. So don't be like, oh, like I'm still applying to med school, like what can I give? Everyone has something to give, everyone has something to bring to the table. Like you can definitely help out with these projects. And WCVIS has actually started up a pre-med group. We want your input too. Like we want to increase outreach, and who better to know what types of things that you guys would be interested than you guys. We like sort of imagine like what we wanted, but we were in your shoes like 2 or 3 years ago. Maybe things have changed. So that is something that you can definitely help us with. And by going to these meetings and like networking and everything like that, you can get access to research. And one of the things about research is that you get exactly what you put into it. And actually, one of the ways that you can actually get some research and get some mentorship in it is actually through Twitter. I actually got onto a couple of research projects through just reaching out to Twitter. Like you will see a bunch of people tweet about their cases, interesting things that they come across. And like you can start building rapport by asking questions about them through like DMs or replying to their tweets, and eventually be like, hey, like I noticed that you're working on this project. Do you mind if I jump on? And people are very receptive to, bringing along someone that they've been talking to about all this. Now, doing all this will set you light years ahead of like where you need to be. Like Jonas mentioned, it is very uncommon that people actually even discover VIR before going into medical school. If you do all this, like you are better positioned than I will say a lot of med students to go into this specialty. But again, like the biggest thing is to actually get involved and get to know what the specialty is like, so whether it is something that you want to do for the rest of your life or not. Now, with that in mind, if you guys have any questions, feel free to reach out to me. This is my email, my Twitter underneath, and also if you guys are part of the pre-med group chat, I am in it. I will introduce myself in just a second, and so you'll have my phone number. Feel free to call me, text me, anything. One of the things that you'll learn, everyone in this specialty is very, very excited to like help you guys out. Thanks.